Now we are going to start our pharyngeal arches embryology. So, where these pharyngeal arches are present is mainly present in our foregut. For example, this is an embryo, folded embryo, right? So it is a cranial end, this is a caudal end. In the cranial end, this is what called as pharyngeal apparatus. They are 5 in number. Remember that fifth one is absent. So you can like 1, 2, 3, 4, but fifth one is absent and sixth one. So first this layer, you can see this outer layer, this is the ectoderm of an pharyngeal pouch, and this one is a mesoderm, and this one is an endoderm. This inner lining is an endoderm. So this ectodermal one is known as pharyngeal cleft or groove, and the mesodermal one is called pharyngeal arches, and the inner endometrium one, that endoderm one, is called pharyngeal pouch. So cleft, this is cleft or groove, this is arch, this is pouch. So we have to study here more about arches because it is going to form many of the important structures in our body. So, and this one is the buccopharyngeal membrane, which forms a future mouth, right? So till now we are understood, and remember that in pharyngeal arches, that is a mesodermal part one, also have some neural crest cells present in them. So next, after this, now you can see that pharyngeal cleft or groove is mainly made up of ectoderm. It is having only important function in its first cleft, which is mainly found in epithelium, which covers the lining of the external ear mainly. And next, coming to the pharyngeal arches, these are of mesodermal in origin. They give rise to connective tissue, cartilages, mainly laryngocartilage, to muscles, bones, and also nerves. Next, coming to the pouches. Pouches is of endodermal in origin. It gives rise to epithelium, glands, mainly what kind of glands, like parathyroid, thymus, etc. Thyroid. So all those things let us see in detail. So first let us see in detail about our middle one, that is our arch, which is mainly made up of mesoderm. So the muscles of the pharyngeal, so actually we have divided this into that the pharyngeal arches forms muscles, nerves, bones, connective tissue, and different arteries, and this is all about arches. And next we are going to see about pouches. So first let us see about muscles formed by pharyngeal arch. So the first arch mainly forms the masticatory muscles. In the name you can understand they are useful mainly for eating the food which have burnt. So it is mainly supplied by the trigeminal nerve, and the masticatory muscles are like pterygoid, temporalis, medial lateral, masseter, mylohyoid, and digastric anterior villi, and tensor villi palatini. So all these are like muscles which are used for the mastication. So these are mainly by the first arch. These are developed by the first arch, and the second arch gives rise to facial expression. So first you can remember like these muscles, like first one we have ate something, and next we are giving some facial expression because after eating some food we give some facial expression. So second arch is like facial expression muscles like stylohyoid, digastric posterior belly, and stapedius. Remember that the first one masticatory muscle is digastric anterior belly, and here the second arch gives rise to digastric posterior belly. And next, third arch is the stylopharyngeus, that is glossopharyngeal nerve supplied mainly. Third arch gives rise to stylopharyngeus, which is also useful for swallowing, all those process. And next come the fourth and sixth arch. So fourth arch is mainly supplied by vagus nerve, and the sixth arch by recurrent laryngeal nerve, even that is a branch of vagus nerve. So what this produce, which kind of muscles? They form the pharyngeal muscle, laryngeal muscle, levator belly palatini. So this all like you need to remember them. So but I give a clue that first one is for mastication. So after eating you give some expression, right? Facial expression. So that is second. And the third one is after giving facial expression you swallow the food. Next you swallow the food. So it is by stylopharyngeus, like that. And see fourth and sixth, pharyngeal muscle, laryngeal muscle, levator belly palatine. So next let us see the bones and connective tissue of the pharyngeal arch. So first arch gives rise to bones like maxilla, zygomatic, mandible, squamous part of temporal, malleus, incus. So if you observe, all these bones are in face and also in our ear. That's it. And next coming to second arch, it gives rise to hyoid bones, stylohyoid ligaments, and stapes. And third arch gives rise to hyoid bone, and the fourth and sixth arch gives rise to thyroid cartilage, arytenoid, cuneiform, corniculate. So all these are like laryngeal cartilages, right? So now let us move on to the nerves of pharyngeal arches. So the first arch gives rise to cranial nerve 5, which is trigeminal nerve. And the second arch gives rise to cranial nerve 7, which is facial nerve. And the third arch gives rise to cranial nerve 4. These are supplied by right. So third arch is supplied by cranial nerve 9, that is glossopharyngeal nerve. And the fourth is mainly supplied by superior vagus nerve, and the sixth arch by recurrent vagus nerve. Next, coming to the arteries of pharyngeal arches. So you can see the first arch is supplied by maxillary artery, second one is stapedial artery, third one is carotid and proximal intercarotid artery, the fourth one is right, it is divided in right and left, right one by subclavian, left one by aortic arch. And the sixth arch also divided right and left. Right one is right pulmonary artery and left one is a left pulmonary artery along with the ductus arteriosus. So this is the one, and some of the extra points are like the first arch gives rise to cartilage known as Meckel's cartilage, and the second arch gives rise to cartilage known as Richard's cartilage. And remember that the first arch also take up a part in tympanic cavity, Eustachian tube, external auditory canal, and the second arch in cervical sinus, palatine tonsil, and also tonsillar fossa. So this lesson is like more to remember, just to revise all these names. But it gives a perfect overview that how to study this lesson, right? So next, coming to pharyngeal pouches. So pharyngeal pouches are of endodermal, right? So they are like divided into dorsal and ventral parts again. So let us see. The first pouch is acting as epithelium, and it also forms a diverticulum, mainly tubotympanic recess, which is present in our middle ear, and auditory tube develops from this tubotympanic recess. And the first pouch mainly gives rise to tympanic cavity, Eustachian tube. Second pouch to the lymphatic tissues like tonsils, like pharyngeal, palatine, lingual, tubular. Palatine is most important, and which is mentioned in our textbook. And next one is the third pouch. It is divided into dorsal and ventral part. Dorsal part gives rise to inferior parathyroid, and the ventral part gives rise to thymus. So if the third and fourth are undeveloped, then it leads to DiGeorge syndrome. And it's coming to fourth pouch. It is also divided into dorsal and ventral. Dorsal give rise to superior parathyroid, and ventral give rise to ultimopharyngeal body, and also C cells, or that is follicular cells. And next, from where the thyroid gland develops, it develops from the thyroglossal duct, which is from the median diverticulum, and derives from the floor of the pharynx at the foramen cecum. So this is all like an overview. So next, your part is to just mug up, read everything, and now let us even check out the diagrams in the textbook so that we can get a complete idea of this lesson. So here you can see how the pharyngeal arches develop between the stomatium and pericardial bulge. So first let us see what are those. So this is a cranial end, right? This is a caudal end, tail bud, and here you can see this is a stomatium. Don't think that stomatium forms stomachs. Stomatium forms the future mouth, and the bulging is produced developing brain. It is in the dorsal part, and ventrally we are having the pharyngeal arches. So neck develops actually between the stomatium and the pericardial bulge. So here you can see these are the pharyngeal arches, which are also known as branchial arches, and these pharyngeal arches are present cranial to the foregut. Next, till now we have only 5 arches because the fifth one is degenerated or it is rudimentary. And next here you can see the forelimb bud is developing, and the pericardial bulge is present ventrally. This is the hind limb bud. So here I have ticked one of the important point, like the first arch is also known as mandibular arch, and the second arch is also known as hyoid arch. So here you can see the difference at before formation of pharyngeal arch and after formation of pharyngeal arch. So this is the ectodermal part, this is the mesodermal part, this is red one is the endodermal part, and this is the primitive pharynx which is derived from the foregut, and this is the buccopharyngeal membrane. So this is how pharyngeal arches develop. So you can see this is the pharyngeal cleft, this is the pharyngeal arches, these are the pharyngeal pouches, right? So endodermal pouches, ectodermal clefts, and middle mesodermal arches. So that's it. We know all this thing, right? So next, let us move. Like I have also ticked one more important point. Like ventral to the foregut we have ventral aorta, and the dorsal to the foregut we have dorsal aorta, and a series of aortic arches are getting attached to them. And here we'll see the structure to be seen in a pharyngeal arch. Nerves are present in pharyngeal arches, aortic arches, cartilage is present, muscle is present, ectoderm outer, endoderm is this side, endoderm is forming our pouches, and ectoderm is forming our clefts or grooves. You can see this is not in humans, this is in some lower animals where they're having two branches, double innervation, like they're having pre-traumatic branch and post-traumatic branch. And this pre-traumatic branch is receiving and it is in a caudal border. And this post-traumatic branch, this green one, you can see this is the outgoing and it's a cranial. It is present in the cranial border. Actually, these are not present in human, but we have found that in human, especially in our first arch, that is which makes the Merkel cartridge, right? The first arch is having double innervation, that is pre-traumatic and post-traumatic. So only in first arch in humans we can find this. So in human embryo, however, a double innervation is seen only in the first pharyngeal arch, right? Here I have found one more important point, like the part of the cartilage which is extending from the region of the middle ear up to the mandible disappears, but its sheet, that is a perichondrium, forms what structures? That is our anterior ligament of malleus and also phenomandibular ligament. So let us check out what are those over here in this diagram. You can see this. The different cartilages which are formed from pharyngeal arches. So sphenoid, incus, stapes, malleus, styloid process, phenomandibular ligament, lingula, stylohyoid ligament, remnants of Meckel cartilage, greater cornu, lesser cornu, body of hyoid, thyroid cartilage, cricoid. From cartilages of fourth and sixth arches, from cartilage of third arch, second arch, and cartilage of first arch. So these are the cartilages. And if we check out this, we have like arch, it's nerve of the arch and muscles. So as I said just there, right? So all those are here again if you want. Okay, let us revise. First arch by mandibular right now, and medial and lateral pterygoid, mesostet, temporalis, mylohyoid, anterior belly of digastric tensor tympani and tensor palati. And second one is by facial, this is muscles of face, occipitofrontalis, platysma, stylohyoid, posterior belly of digastric stapedius, auricular muscles. And the third one is by glossopharyngeal, stylopharyngeus. Fourth one is superior laryngeal and muscles of larynx and pharynx. Fifth one by recurrent laryngeal, right? So here we are having the muscle derived from somatomeres and somites. So we know somatomeres or somites are part of pharyngeal mesoderm, right, of intraembryonic mesoderm, right. So the somatomere 1 and 2 gives rise to muscles supplied by oculomotor and nerve, and somatomere 3 superior oblique muscle supplied by trochlear nerve, somatomere 4 muscle of first pharyngeal arch supplied by mandibular nerve, somatomere 5 a lateral rectus muscle supplied by abducent nerve, somatomere 6 by muscles of second pharyngeal arch supplied by facial nerve, somatomere 7 by stylopharyngeals and supplied by glossopharyngeal nerve, occipital somites 1 and 2 laryngeal muscle from 4-6 arches supplied by vagus nerve, occipital somites muscles of the tongue supplied by hypoglossal nerve. So that's it. And pre-traumatic, yeah. And we have also found one important point over here, like pharyngeal arches derived from the pharyngeal mesoderm, cranial to the occipital somites from the region of the pre-occipital somites, and that is organization influenced also by the neural crystals, and these are forming somatomeres. So as I said that the first arch is having double nerve supply. So the mandibular nerve is the post-traumatic nerve over first arch for the first arch, and the chorda tympani is a branch of facial nerve and it's a pre-traumatic nerve. So here we can check out the cervical sinus, left half of the figure, yeah. So you can see the projection growing downwards from the second arch. This is the cervical sinus, the first arch. Cervical sinus lying deep to the downward projection. And next, first pouch is also, that is, these are the endodermal pouches, if you remember, that is endodermal origin. So they're also having ventral dorsopart, right? Ventral part gives rise to tongue, dorsal part to the ear, and we also have the proximal part of rhesus give rise to auditory pharyngeotympanic tube, and the distal part to the middle ear cavity, including the tympanic antrum. And next, the second pouch gives rise to ventral and dorsal again, the ventral to the tonsil and the dorsal to the ear, the ear part is nothing but the tubotympanic rhesus. And next, coming to the third pouch is dorsally, we know it as inferior parathyroid, thymus ventrally, fourth pouch superior parathyroid dorsally, and thyroid ventrally, right. So let us check out the diagram over here about pharyngeal pouches. So dorsal 1/2 tubotympanic rhesus, tonsil, parathyroid 2, 4, and lateral thyroid, thymus. So here you can check out the ventral tongue, ventral tonsil, inferior parathyroid and thymus, superior parathyroid and thyroid. So this is how you can check out the structures over there. And ultimo brachial is also formed by sometimes fourth pouch and also sometimes by fifth pouch, that too by ventral part. And a fourth pouch and fifth pouch together form caudal pharyngeal complex. This you need to remember. And the complex probably also gives rise to C cells or parafollicular cells of thyroid gland, right? So how the development of thymus takes place? It's by mainly third endodermal pouch. So this invading mesenchyme invades the thymus, and it makes into a lobular structure. And you can see derivation of superior and inferior parathyroid. Note the relative position of parathyroid 3 and 4 is reversed during development. So you can see this is a third pouch, this is a fourth pouch, this is a parathyroid 4, parathyroid 3. So how they are they are reversed in direction. So this green one are coming lower and the red one are going upper. So you can see in the thyroid gland, this is superior parathyroid and this is the inferior parathyroid. And one more important thing is like the medial ends of the two mandibular arches are separated by middle swelling called tuberculum impar. So you can see this is a tuberculum impar, and also the floor of the pharynx shows thickenings in the midline. The region is soon depressed. Diverticulum called thyroglossal duct. So this is a thyroglossal duct which are described, and the site of origin of diverticulum is known as foramen cecum. Yeah, foramen cecum is where we get this. So here you can see the floor of pharynx showing the foramen cecum from where the thyroglossal duct arises. So this is lingual swelling, tuberculum impar and midline structure. This dotted structure is a foramen cecum, blue dot. Hypobranchial eminence, tracheal groove, sixth arch, fifth arch. So all the arches are like that. And the site of formation of foramen cecum, the floor of pharynx, thyroglossal duct, bifid lower end. So this is the thyroglossal duct, thyroid developing from the thyroglossal duct and the lateral thyroid from the fourth pouch. So you have drawn a simple diagram. You can see this is a foramen cecum, this is a tubercular impar, this is a thyroglossal duct, and this is how the thyroid is formed. A very simple duct structure to explain it. And remember that developing thyroid comes into intimate relationship with the caudal pharyngeal complex and fuses with it. So the cells arising from the complex are mainly believed to give origin to parafollicular cells of thyroid, which may represent the ultimobrachial body of lower animals. So let us see some anomalies related to thyroid gland, like pyramidal lobe is present. So it's also a normal structure, so it's not such kind of, and arise from the isthmus and or one of the lobe, and it may have no connection with the rest of the thyroid and may be divided into two or more parts. So in the extent it may vary from the short stem to process reaching the hyoid bone. So isthmus may be sometimes absent or present, and one of the lobes of the gland may be very small or even absent. So if we check out the structures, we can get the variations in pyramidal process of thyroid gland. So you can see this is a hyoid bone, this is a levator gland thyroidae, this is a pyramidal lobe, lateral lobes, and the middle isthmus. So B, this structure you can see it is abnormal, and C, yeah, so these are abnormal. Anomalies of thyroid gland, the parts of the gland shown in dotted outline are missing. So sometimes this dotted outline may miss, and it's an anomaly. Next, coming to the anomalies of position. Lingual thyroid. The thyroid is under the mucosa of the dorsum of the tongue and may form a swelling and cause difficulty in swallowing, of course. And intralingual means the thyroid is embedded in muscular substance of the tongue itself. And the suprahyoid means the gland may lie in the midline of the neck above the hyoid bone. And the infrahyoid means, in the name you can understand, gland is below the hyoid bone, and it's sometimes normal also. Intrathoracic thyroid means the entire gland or part of lie in the thorax itself. So that's it. Note when thyroid tissue is present in an anomalous position, an additional thyroid may or may not be present at the normal site sometimes. And ectopic thyroid tissue, small masses of thyroid may present in abnormal sites. Then thyroid tissue is like observed in larynx, trachea, esophagus, pons, pleura, pericardium, ovaries. So masses of ectopic thyroid tissue have been described. So in relation to deep cervical lymph nodes also, that is the lateral aberrant thyroids. But these are now believed to represent the metastasis in lymph nodes from carcinoma of thyroid gland. So we also see the remnants of thyroglossal duct, thyroglossal cysts that may occur anywhere along the course of the duct, and they acquire the secondary openings on the surface of the neck to form the fistula. And the thyroglossal fistula opening at the foramen cecum, carcinoma of thyroglossal duct may also take place. So in surgical removal of thyroglossal cysts and fistula, it is mainly important to remove all remnants of thyroglossal duct. And in connection, it has to be remembered that duct is intimately related to the hyoid bone, right? So we have the path of thyroglossal duct. Note that thyroid tissue may come to lie anywhere along the course of the duct. So we can see this is a tongue, this is lingual thyroid, this is an intralingual thyroid, this is suprahyoid means above hyoid bone, infrahyoid below hyoid bone. So this is a hyoid bone, this is a thyroid cartilage, this is a part of thyroglossal duct, this dotted line, right? And the normal position of thyroid is this, and this is a cricoid cartilage. So here we have some timetable of events like 4th week 22nd day appearance of first and second arch, 5th week 29th day 4 arches are seen, that is thyroid, parathyroid, thymus start forming. 7th week the thyroid gland reaches its definitive position. So by this we have completed our whole lesson in a very perfect manner. So once if you read the textbook, it will be very clear.